Hi, I'm Henry Acosta reporting you today for Health Professional Radio. On air with us is Professor Terry Bolin. Professor Terry is one of Australia's leading experts when it comes to the matters of gut and has been with the Gut Foundation since 1983. Did you know that April is IBS month? IBS stands for Irritable Bowel Syndrome. IBS affects around 20% of Australians, and in some shape or form, and 1 in 5 of those will experience extreme debilitating symptoms, and 2 in 5 will experience moderate symptoms, which also interfere with work and social activities. Women are 3 times more likely than men to experience IBS, and it can affect all people of ages. Professor Terry is with us today for the Gut Foundation and helping raise awareness on IBS and what you have to know about it. Hi, Professor. Thanks for coming in on the show and helping spread awareness on the issue at hand.
It's a pleasure. IBS is very common, affects about 20% of the population, particularly younger people, teenagers and young adults. Women outnumber men about 3 to 1, and it's usually a long-term problem that waxes and wanes for reasons that we don't always understand.
Well, how did you end up working with the Gut Foundation and with regards to IBS?
Well, we began life just over 30 years ago, really talking about bowel cancer, which is the commonest internal cancer in the country, affecting 55% men and 45% women. And we wanted somebody who was a gastroenterologist to stand up and talk openly about the process of management with either testing feces for blood or doing colonoscopy. And then we've gone on from there in the educational area, looking at heartburn, celiac disease, irritable bowel, diverticular disease, and most things that affect the gut and that people want to know more about.
I see. And can you tell us a little bit more about yourself and how you got started with becoming a professor?
Well, I'm a gastroenterologist, and the foundation began when I was secretary of the Gastroenterological Society of Australia, and we wanted some independent body to talk about common problems and not be seen as trolling for work like colonoscopy, somebody quite independent. And so we've gone on from there, largely in the process, in the areas of education, but also research. So we're currently doing significant research in why people become malnourished in later life, and that's due to the fact that they don't always absorb all their food properly. And if we can intervene in that, then we should make big benefits in terms of the population as they age. And also, people want to know about why they have a particular disease, how they might be treated, and that applies particularly to IBS. Many people tell patients, look, it's nothing much to worry about, go away and live with it. But as you said earlier, 1 in 5 are quite severely affected, both in terms of their work and social activities, and there are many good treatments available that are going to help them. So they shouldn't accept the advice to do nothing. It might all be in their head. It's a very real phenomenon.
And how do we get IBS, or what are the causes of it?
Well, about 25% will follow an episode of gastroenteritis. So that might be something like barley belly or gastroenteritis in Melbourne or Sydney. It doesn't matter what the virus or parasite is. It does affect the colon and then moves on, but leaves you with a legacy of an altered bowel habit, pain, and bloating. It's always worse in women, usually around the time of their periods. It's not worse in pregnancy. It's not caused by stress, but it is worse with stress. And operations and illnesses might trigger a flare. So there's a whole variety of problems that might make it worse potentially.
And what are the other usual symptoms that means that you have IBS?
Well, you'll have a change in bowel habit. So you'll either be constipated, or you'll have diarrhea, or you'll just have an erratic bowel habit with alternating constipation and diarrhea. Constipation is usually associated with bloating, and bloating can occur anywhere in the abdomen, high up, low down. If it occurs low down, then you might presume that it's due to fermentation of foods that accumulate during the day. If it occurs early in the day, then it might be IBS that arises in the small intestine, which is sterile and therefore doesn't involve fermentable products. So with small intestinal IBS, fat and caffeine are going to make it worse. With colonic IBS, that's where there's 2 kilograms of bacteria in the bowel, they're going to ferment food that escapes the process of digestion and ultimately produce about 25 litres of gas per day. Now, a lot of that you will reabsorb and expire in your breath. A lot is used by other bacteria in the bowel, and some you'll pass as wind. But you have to move that gas onwards, and that requires muscular activity in the bowel called motility. And we think that motility is largely under control of the unconscious or autonomic nervous system, which also controls the circulation. And one mirror of a problem with the autonomic nervous system is that people will complain of cold hands and feet. And that might alert you to the fact when you shake their hands and notice they have cold hands, that they may complain of constipation, irritable bowel, bloating, or heartburn.
And how do you go about treating IBS?
Well, you start with the diet, and there are things that you should add and things you should exclude. So things that you add are usually fiber, because many people believe they're on a high fiber diet because they eat a lot of salad. But you have to have some grains as a breakfast cereal together with fruit and vegetables, and you aim to produce a sausage a day. That's a good indicator of a high fiber diet. But you have to do that relatively slowly and allow the body time to adapt to the increase in fiber. And the same with any of the other changes that you make. So you will ask about their intake of fat and caffeine. You go through their diet and identify any windy vegetables that might be contributing. And it's the wind that produces pain because it's trapped with poor motility, and that causes the bloating. And so you need something that is a pain relief. That's an antispasmodic. So you might buy Buscopan over the counter or Colofac on script. And sometimes people benefit from a very tiny dose of an antidepressant. And then there are other medications. There's a herbal preparation called STW5 or Iburogas that's been shown to have an effect on the nerves and muscles in the gut, and that's often of value together with antispasmodics in treating bloating. And you've got to treat the constipation. So that might involve a laxative, but there are some new laxatives becoming available that act on the nerves and muscles in the gut and are more predictable than laxatives which can be either a fast or a feast or a famine. So they are called prucalopride or Resitrans, and another one coming is called linaclotide. That may be here next year. So there are always changes coming in the future, and you need a GP or gastroenterologist to guide you through changes that might be coming and help you understand how they're going to work. You might also need the help of a dietitian, particularly if you go on to some dietary change, like the current FODMAP diet, which eliminates a lot of the fermentable foods in the diet. But that will work only in the colon and will have no effect on the small intestinal irritable bowel.
And what's usually the biggest misconception that people always have with regards to IBS?
I think they don't like the diagnosis. They are told by somebody, either a friend or colleague or their doctor, look, it's all in the head. It's not.
Mm-hmm.
It's a real physical problem for which there is a real physical solution. It may take time to find the right combination of medications or lifestyle that will do that. But you have to be prepared to persist and not to take the easy route out and say, I can't do anything about that, I'll just live with it.
Mm. And what's the main message that you want people to learn about IBS?
That it's common,
Mm-hmm.
and it's treatable, and it's long-term, and you need somebody who will listen to you and help guide you through the next few years where you might have symptoms that wax and wane. So don't give up, get help.
And for people interested in reaching out to you and maybe finding more about IBS, how can they do that?
Well, we're having a day on the 28th of April, which will be a social media day talking about IBS. They can visit our website on gutfoundation.com and obtain our booklet on irritable bowel and any other booklets that they're interested in on other gastrointestinal problems. But there's always help available.
Awesome. And are there any other events or talks that are coming up that you think people should know about?
Well, we'll also be talking about inflammatory bowel disease later in the year, and that's colitis or ulcerative colitis or Crohn's disease, and they're both common, particularly Crohn's disease, which is increasing in prevalence over the last 20 or 30 years. Now some wonderful treatments. So there's always something happening, always something new, and always the option to improve your life.
Awesome. Well, that's all our questions for today, and thank you for coming on the show, Professor.
Okay, my pleasure.
And that was Professor Terry Bolin, and we just finished talking about IBS, or Irritable Bowel Syndrome. You can find more health-related interviews on www.healthprofessionalradio.com.au or on hpr.fm. You can also find us on SoundCloud and iTunes. I'm Henry Acosta for Health Professional Radio.